very good morning to one and all. I'm going to be presenting on systemic emergencies, a roadblock to cataract surgery. In India, 71% of visual impairments and 66% of blindness among individuals aged 50 years and older is due to cataract. Phacoemulsification under topical anesthesia is the preferred choice of treatment for cataracts. This is due to the reduced intraoperative systemic complications. However, in the elderly population, due to the systemic conditions like diabetes, hypertension, cardiovascular disease, or chronic kidney diseases, there is an increased risk of these complications like pulmonary edema, myocardial infarction, and anaphylaxis. Though the primary focus of cataract surgery is ocular outcomes, however, systemic health can never be overlooked. To undermine this, we have done a study to determine the overall incidence of intraoperative medical complications and identify the relevant clinical parameters. This was a retrospective observational study done in a tertiary care eye hospital in South India. 5 years of data was collected from January 29 to December 2023. The data was retrieved from electronic medical records. So those patients who had a systemic emergency during cataract surgery were included, and those who underwent combined procedures or when the surgery was done in general anesthesia were taken out of the study. During the preoperative evaluation, we did a thorough history taking of the systemic condition. The vitals were recorded and necessary blood investigations were ordered. After physician clearance, on the day of the surgery, patient's vital signs were assessed before shifting the patient to the OR, and an intravenous access was gained in the high-risk patients. On table, the pulse rate and the oxygen saturations were monitored for all the patients. So we defined a systemic emergency as when the patient complains of any breathlessness, chest pain, severe cough with crepitus on auscultation, or if the pulse rate was above 140 or less than 40 beats per minute, or if the SpO2 dropped less than 90%, or if the diastolic blood pressure shot more than 120 millimeter of mercury. In case of an adverse event, the anesthetist was promptly stabilizing the patient and was shifted to the ICU or the nearest multi-specialty hospital for further management. The statistical analysis was done using Strata 17. Coming to the results, 443,712 cataract surgeries were done during this period, and 20 cases had systemic emergencies. Looking into the age group, the study population fell between 44 to 79 years, and our study showed a slight female predominance, accounting for 65%. Of the 20 patients, almost 17 people had at least one systemic condition, in which 11 of them had more than one systemic conditions. The various adverse events that we saw were pulmonary edema, myocardial infarction, atrial fibrillation, angina, and allergy. Pulmonary edema was the most commonly documented systemic emergency, with 14 patients having pulmonary edema. 11 of them had previous history of systemic conditions, systemic hypertension or cardiac diseases. The p-value was significant. Looking at the parameters, we compared the physiological parameters between the pulse rate, systolic blood pressure, diastolic blood pressure, and the oxygen saturation in aborted cases versus completed cases. The p-value was significant, indicating that these parameters must be overlooked, and these will help in giving the surgical outcome. Visual outcome, in the cases of completed cases, the visual outcome was better, whereas in the aborted cases, the visual outcome was not as good as seen. We did not find any significant correlation between the anesthesia type or the waiting time or the surgical duration with the development of systemic complications. Going into the discussion, like I told, of the 443,712 cataract surgery, 20 cases had systemic emergencies, of which 10 were aborted midway to stabilize the patient systemically, and 2 patients underwent successful resurgery. Pulmonary edema was the most commonly observed systemic emergency. 85% of them had at least one systemic illness, and there was a 50% cancellation rate, and all of them needed ICU care. There were no fatalities documented, and the completed cases had a better visual outcome. We did not have many studies related to this. Whatever were available, most of them did say that there is chances of systemic complications occurring during cataract surgery, and they must never be overlooked. Limitation, the sample size was pretty small, so we couldn't find many risk factors. And looking into the future recommendations, we have to look into the preoperative optimization of the patients with multiple comorbidities. This might prevent intraoperative complications in high-risk population. Conclusion, we must integrate systemic health assessments into routine cataract surgical planning, and we must have a multidisciplinary collaboration among ophthalmologists, anesthetists, and physicians. And we shall strengthen monitoring protocols to detect and manage these systemic complications. These are my references. Thank you.
Thank you. So you told that your sample size was small.
Yeah.
Out of 463,000 people, what do you mean to
She's
say?
talking about the number of complications.
Systemic emergencies.
So that systemic emergency is not your sample size.
No.
Sample size is your total size. So you cannot have more sample size of more than 4.5 lakh people. Systemic emergency is a part of those who are having this. So sample size cannot be larger than this. It's already very large sample size.
So Dr. Archana, actually a nice presentation. The thing is, this preoperative checkup in the army, routinely we have every patient going to the OT, whether you're going to do it under topical or with the block, has to undergo a complete checkup. In spite of that, these complications occur. And I read a very nice article in Canada. There is a district where the insurance people found that before cataract, all patients were being referred to the physician, cardiologist, and they stopped paying for that. They said only blood sugar and BP is permitted, nothing else. And a 1-year follow-up showed that the number of hospital admissions for cataract cases went down. The post-op results were better because generally, since we are doing it under topical, most of the patients, like out of 4 lakh something, you had hardly about 20 odd of this thing. So, in fact, they've stopped carrying out a pre-operative evaluation if you're going to do a cataract case, patient under topical, unless there is a known pre-existing condition for which you need a clearance.
Yes, sir.
So nice talk. Thank you.
Thank you.